Hey everyone, Dr. Todd from Gonstead Spine Wellness. We're here for a Monday staff training. We have our team back here, but this is a special day because today is a belt test. We talked about this a couple weeks ago. Was it a couple weeks ago? Okay, 2 weeks ago at staff training, and we're doing a belt test. Before we get started with that, let me just say, if you have not subscribed to our channel yet, please subscribe, like, comment. You'll see a lot of our team's comments on there too. Did you guys comment on our video yet today? Yes, see, look, so. You can jump on, you can see all of our different staff commenting as well on our videos. We have usually 2 to 3 out per week. Understand too, we serve 2 audiences. One is patients and those who want to learn about natural health and healing. And the second one is chiropractors who want to introduce functional movement, corrective exercise into their practice, like this stuff. This is functional movement. We're going to go through some kettlebell stuff here briefly. And then our team is going to go through, no pressure, and they're going to do it. And they're going to show the world that they understand how to get from their white, this is all white belt to yellow belt? Or, oh, this is yellow belt to blue belt. Okay, gotcha. So a little bit of all that, so a blend of things. So can you pull up the little belt sheet or something? I'll just let the audience know what the belt system is, just to fill you in real quick. If you look up on the board there, if you want to scroll up there, you'll see there's these belts. So our patient names are listed. They start at a white belt, yellow belt, blue belt, and it goes all the way up to black belt. You'll notice there's less names as it goes higher because it is harder. It takes more skills, more understanding to get through the belt system. And the reason we did the belt system was to make this fun, was to gamify the process. Watch out for that kettlebell. Watch out for the kettlebells, yeah. So a rule in kettlebells, you know, this is like one of the first rules is you never put a kettlebell behind you, ever. So like this setup would only be if I'm facing it and I see it. I would never have anything behind me, okay? I mean, it's kind of an unfair rule for our camera woman because she's not watching where she's going, so that's okay. So can I see the belt, just the list from white belt forward, you know, our normal list of the progressions? Is it just in the 12-week transformation? Cool, I got it. All right, so this is our 12-week transformation booklet. This is something that our patients go through, and we as a team are making sure that we are going through it as well. So some of our staff that haven't been here as long, and some of ours that have been here longer that already know this stuff but haven't officially tested are gonna test. And it starts off at white belt. It lists what things they need to understand. And the reason that we did this is not because we're a martial arts studio, but it's because it makes this more fun, more engaging. Patients get competitive with it. And it also helps our exercise team and our doctors and everyone else immediately know where a patient's at, like what they know. You know, you can look and see, oh, they have a black belt. That means they must know a lot of stuff. Kind of like if you go to any martial arts or jiu-jitsu or anything, you'll look at a belt and you'll say, I'm not gonna mess with that person because they know this, or I'm gonna go to that person because they know more than me and I can ask them. And in the background, they're trying to get our new GoPro working, so you hear some beeps. But how's it going? Let's come over here and see what they're doing.
Oh, okay. So you swipe on the screen.
Oh, so that's what's supposed to do it? And this is Audrey and April, so between Audrey and April, we should be able to get this figured out. Okay, anyway. So what we're gonna do, so who's testing from white belt to yellow belt? And then tell me what you have to know.
The first 3 steps of the get up and deadlift.
First 3 steps of the get up and deadlift. So I'm gonna demonstrate it real quick. I'm gonna talk out loud what it is, and then we'll cut away to you guys, and you guys will do it. How about you? What are you doing? Yeah, same thing? Okay. And then who's going from yellow to blue? And then you have to do the full get up.
I was actually teaching my boyfriend to do it yesterday.
Nice. So then you know how to do it. Okay. So the first thing we're doing here, we're hip hinging. This is for a deadlift. Okay. We're looking, this is neutral. So we're not looking up, we're not looking down. All right, we're not rounding the low back. We're not going knees over toes like this. Okay, so you're hip hinging, grabbing, bending the handle. So this has to engage. So technically if you don't see that, if this doesn't engage, lats don't engage, then it's no go, because that tightens everything up in the upper body. So here, and then breathe. So a little sniff in. And then when you get to the top, you should be looking straight forward, head tall. You might have to, I always have to correct myself for the first couple, pull my shoulders back, push my arms down, get my head high, and then tighten the abs, tighten the kneecaps. So if I was wearing shorts, you see my kneecaps drawn up, quads are on, glutes are on. And then when you lower, Same thing, you're gonna hip hinge back, so your butt goes back, and that's how you lower it down. Okay, so that's a deadlift. All right, clear as mud, good. Then the first 3 steps to the get up, might as well do all the steps real quick, but the first 3 steps is what most of us are gonna have to test on. So the first thing is you pick the weight of the kettlebell. I'm gonna do this one, which is 35 pounds, so it's pretty light. It's light for me, but you have to make sure it's sized right. So these are the weights that everyone's doing? Is that the plan? Is anyone doing a heavier one, or no, this will be a little too heavy for you? Okay, so you're gonna go on your side, and you don't pull the kettlebell towards you. You snug up to the kettlebell, okay? So that's an important part. Palms up, grab it like a gun, if that reference helps for those that shoot. And then you're gonna roll, and you're gonna bring this onto here, onto your abdomen, right by your belly button. So the thing with this is, don't bring it way up here. Have it right here, okay? You can reposition it if you want it to be more comfortable on your forearm, but from here, you're gonna punch up with both hands. So both hands have to come up. If you don't do that, that doesn't pass. All right, then when you let go with one hand, don't let this drift out to the side. Keep it pretty much vertical to your shoulder. All right, don't be way over here, don't be way out here, don't be up, don't be down. That's a side effect of the weight being too light. It doesn't force you to do it right. And then make sure the wrist is not an extension like this. That's extension, that's neutral, okay? So you have to almost feel like you're flexing your wrist a little bit, or you will be bound to put it in a little bit of extension. You bring this leg out, okay, about deadlift stance. So if you're deadlifting, all right, or jumping, and then this arm, don't come straight out to the side, keep it about 45, okay? Thumb can be up if you want, it can be flat like this. I like to use this little handle cue. Has everyone learned that? Like the stick in the ground cue, right? Okay, that's thanks to Czar Horton, strong first master kettlebell instructor, patent pending, right, Czar? Okay, so right here, he always tells me, don't tell people that, don't share that with them. Like it's this total secret, we can't tell anyone. All right, so then from here, what you're gonna do is you're gonna push off this foot. This is a cue we give people, is we say, stomp your foot in the ground, activate your glute to bring yourself up, okay? If you don't do that, this just goes limp and dead and you're not pushing through that glute on the right side. And then this right here, you're gonna pull, like you have a handle on the ground, and you're gonna push simultaneously. So you're gonna sniff in, and you're gonna sit here, okay? And you're trying to get tall, like you're touching the ceiling, and you don't wanna collapse this shoulder in. See that, how I shrugged in like this? All right, so this is separate. You wanna create as much separation between your ear and the ground, or your ear and the shoulder. And then from here, what you're gonna do is you can windshield wiper this arm, or you can just put this hand flat, and you can slide it and reposition it. Okay, I'm looking up at the kettlebell, I'm not looking straight forward. So I'm looking up, this back hand right here, I'm turning it into the ground, so I'm not doing this with my shoulder. See this, how my shoulder's forward? Bad. You want the shoulder backwards, much stronger position. Now my scapula is packed, my shoulder blade's packed. Okay, this is the first 3 steps, right? So the next step is with this right foot, I'm gonna lift myself up, and as I lift myself up, I'm gonna drag my knee so it's kind of right behind my heel, all right? So then from there, I'm still looking at the kettlebell. I'm gonna shift my weight. I'm hip hinging in my left hip. This is a single hip hinge right now, all right? So I'm hip hinging, and then it's just easy for me to tip up because all the weight is on this right side. I'm gonna straighten this out. I can reposition as many times as I want, okay? And then lock my elbow. That's the hard thing for me. And then we're gonna stand. And as soon as we stand, you go from looking at the kettlebell to looking straight forward. And then you take this hand, smack your leg. Why do you smack your leg? So you remember which leg to go backwards with, because some people will go backwards with the wrong leg. But yeah, maybe that too, activates the muscle, good. So then here, so step back. Now I'm gonna start looking at the kettlebell. Windshield wiper the leg. Hip hinge, still looking at the kettlebell. Trace that hand out as far as it'll go. Oh, there it is. Shift the weight into the hand. Come through. Okay. Turn. See how I did that? Turn. grab the ground with that stick thing, Czar Horton, patent pending, and then push away. Breathe out so you can come down slow. Grab here, down here, roll to the side. Okay, so that was all 6 steps. So 3 steps real quick, because then I'm gonna hand it over to you guys. Here, here, press, okay, here, sit. Okay, that's it. And then back down is gonna be, when you come down, the control of coming down forces you to activate your core. So if you just fall down, that means you know what to work on. And you can do it with this. You can do drills with this, where you literally just do reps like that, where you go, okay, I gotta work on that. I'll go lighter weight, and I'll literally just practice going. That's a good way to practice it. You can do pal-off presses, various core activation stuff. Notice I didn't say do crunches or sit-ups, because the abdominals are not primarily for flexing, they're for resisting rotation. That's what the core does. So when patients say, what exercise can I do? Because when I do crunches, it hurts my low back. Well, yeah, that's spinal flexion. You don't need to do spinal flexion, you can just resist rotation. That's what a pal-off press does. That's what the first 3 steps of a get-up does. All right, now I'm out of breath, because I'm talking and moving and haven't done a get-up for longer than I should admit. So, who wants, did you figure it out?
It says it's recording, but you can't even see anything.
Oh, I think you can just touch it, right?
Well, that's what.
I think there's preferences.
Okay.
So it's really
It's very
slow. Like, yeah,
You touch the screen, like touch a button, and it doesn't do anything until like
30 seconds.
Hmm.
Like 20
Yeah.
I think it needs
Okay.
to be plugged into a computer and like updated.
Yeah, there is an update. Okay, that'll be Jenna today. Good job, Jenna. All right, so who is up first? Who wants to go first? Let's go white belt to yellow belt. So everyone white belt to yellow belt is everyone except for Helena, right? And you're going yellow belt to blue belt too? Is that, yeah.
no, me.
Oh, you're going yellow belt to blue belt.
So Emily and Helena will be good.
Cool. So then we got 3 of you. So who wants to go first? 1, 2, 3, not it. All right, Jenna's going first.
I just don't even know what I'm recording.
You can just like walk around and get different shots and
It's
stuff.
flex.
Man, can you change it up?
Oh.
You gotta wait 30 seconds until you press
Like,
after you
it's-
press something, or it's gonna like
I feel like I should try
catch
to
up and
update it.
it's so bad.
Hmm.
It's the lag.
Is it like a newer version of GoPro?
I
Well-
think it just needs like a software update.
Yeah, it's.
Okay, we just keep playing around. We'll see what we get. We're gonna rely on Linda. Is this the best angle?
Yeah.
Okay. All right, so Jenna's doing deadlift first. So why don't I do this? I'm gonna mic you up and I'll let you just talk through what you're doing.
I don't want to talk through it.
No? Okay, fine, just do it. Fine. Fine, you do it and I'll talk through.
I should do for deadlift.
You can start with the yellow one if you want. 35 pounds. So remember to lift it. So in all of this, lift it like it's 100 pounds. So don't bend over and slouch and do it the wrong way. So there you
You
go.
want me to pick it up
Yeah,
and move it?
yeah, that's fine. Nice. What happened?
It's just
Did I screw it up?
no, it's just the lag is horrible.
Okay. All right, looks good.
You know.
Cool, very nice. All right, we'll say that's a pass. Good job. Try to, and don't be afraid to breathe out loud so people can hear it. I know it sounds a little silly sometimes. You should see when you're doing like strong first and you're doing squats, you go to the bottom and you go, oh, and you have to say it that loud or it's not, so it kind of gets you over the, making noise thing. All right, so this is a get up now? Okay.
Those other ones.
Yeah.
Out of the way.
Here, I'll get these out of the way for you. Okay. All right, Jenna, brave Jenna going first. Good job. Okay, remember. Yeah, so start real quick, pull it to your umbilicus, pull it to your belly button. Just, if it was 106 pounds, you wouldn't be able to pull it over like that. Good. I'm making the sound for you. Vertical arm.
The breathing hasn't, I haven't really.
So totally vertical with that arm. Get it totally vertical. There you go. Okay. And then don't shrug that left shoulder up. Yeah, separate out. Good. And then get up on that hand on that left side. Good. Tall. Proud. Okay, cool. And then come on down. Okay. Yep. And breathe. Cool.
Actually, breathing through that part really does.
It helps. Forces you to brace. Cool. For the sake of right now, I'm going to give it a passing score, and you could do on both sides.
Want to do both sides?
Yeah, let's do both sides. And when you do this, and Jenna was brave for going first. So hey, if I'm explaining something, you can come over to me real quick and I'll just explain it. So Jenna was brave going first, but the thing that she needs to do, everyone needs to do, when the weight's lighter, it's easier to hold it in front of you like this. You have to hold it straight vertical. So when you're coming down, Jenna kind of went like this, and as she started coming down, she's like, and like moved it at almost like 45 degrees. So just keep that in mind. So she's strong enough with her anterior delt to like front raise and hold the weight, which is not what you want to get used to. Okay, good. Totally silent. Like it. It's like we're playing golf.
My glasses are like sitting on my face and they're like compacting
You got it.
Do you have to reset?
Go a little wider with your left foot. There you go. And then take your foot and go like this in the ground a couple times. Wake up your glute, and you're gonna push through that left glute. And breathe. Nice. Good. You woke it up. Nice. Good job. And then, yep, vertical. Good. Awesome. All right. I think that's passing. What does everyone think?
Yeah.
Good job, Jenna. All right. Who's up next?
I'll go next. Are you gonna bow?
Oh, is there belts? There's belts. Wait, hold on a second. We have to make it official. You gotta...
get a white or maybe yellow.
There you go. Look under your chair, and you have, right?
Who has the black?
She's doing like the Oprah thing, right? You get a car. You get a car. All right.
You get a spool. You get a...
Yeah. All right. We have Shay, aka Shayla. Okay. Remember, everyone, don't be afraid to breathe. You get extra brownie points when we can hear you breathe.
Okay.
So hold on just 1 second. Let's go back down real quick. Step a little bit more forward. Have it right between like the center of the foot. Yes. Yep. Yep. Get it. Good. Okay. It's good. Just really think about driving back with the hips, and maybe getting a little lower with the hips, so that when you bend forward, it's not like this. It's not like straight here.
Okay.
Not all torso, but this is still staying at like an angle, so it's instead of here. Okay.
That's what I was trying to make. Yeah.
And then drive back with your hips to put it down. Cool. All right. I'll give you a pass, and there's some things we'll work on with that, with everyone too, but that was good. Good job. She's doing it again for extra points. Oh no, she's just picking it up. All right. She's like, I'll do it 3 times. All right, let's go here. Good job. She's starting off lefty. Look at that. Okay, and just a friendly reminder, get your legs wide like a deadlift, not too wide, but deadlift width, and then have that left hand palm facing Jenna instead of facing the ground. Yep.
Facing Jenna.
Yep, and then make sure that your wrist is not extended on the left side. So flex,
Yes.
so like flex your wrist, kind of like, yeah. There you go. There you go. Even a little more. If you can always take that hand if it hurts. You can like reposition it so it's in a comfortable spot, which is a relative term because when you first start doing this, nothing's really comfortable. And then breathing with this is you breathe in, and then right before you start pressing, you go, yes, yes. Okay, so make sure those are two distinct steps, not just one step going into there.
Okay.
So let's lower you back down. Okay. I'm giving the special effects here. Okay, great. All right, and then palm towards Jenna. So don't go palm towards feet. There you go. And then get that wrist out of there. So flex. There you go. Good. Now grab it with the other hand. Okay. Good. And then keep in mind too, when someone's learning this, if they ever look a little shaky and whatnot, like I'm kind of at that point where I just want to do this because it's her left. She's starting with, you're not left-handed, are you?
No.
You're brave starting with your left. Good job.
Get the worst one out of the
That's
way.
right. That's awesome. So spotting this is an important thing for all of us to do with patients when they're doing it. Even if they've worked their way up, the first couple times we spot it, because like some people can just go weak. You don't want kettlebell to the face or the teeth. So let's try the other side, and I won't touch the kettlebell. So that's one way of flipping it to the other side, which I don't love, but here's a better way of doing it.
Okay.
So there's two ways of doing it. One is you do a halo around your head. Have you seen that? Have you seen that?
No, I have not actually.
So watch, we'll go there. So get back how you were before, and then just drag it on the ground. There you go. How cool is that? There we go.
What's the other way?
The other way is you flip your body around. So if you're facing this way, you just move the other way.
I had a kid one time. I was like, okay, I'm gonna do it to the other side of you, and they just
Palm towards me. Good. And then spotting this is like this. This is how you spot.
Just like that.
Yep, so I'm gonna spot you, I'm not gonna touch it. So,
Oh.
get this a little wider. Stomp that heel into the ground a couple times. Stomp that, wake up your glute. Okay, let's go. Good. Okay, good. Cool, all right. And then down by the belly button. Good, cool. For right now, there's always little nitpicking we can do. The fact you got it and you got the main steps is what's important, and you're doing it really, really well. So there's little things to clean up on it, like that make a big difference. I'll just show you like a little quick little tip, like when you're here, and you come up, okay? So when I'm lowering, this is what I'm thinking. I'm thinking I got a headlight on my chest, and it's pointing kind of at the camera right now, okay? Right there where I'm looking. What I'm gonna do is I'm gonna turn that headlight now towards the wall over there. You see how I'm doing that? So I'm not this, I'm turning, and then kind of coming away from that, like I had a rope connected on my chest, tied onto that wall.
Okay.
Okay, so it's like these little body position things. They're not there just to like give rules, but technically it allows you to use your body in a stronger way. Mm-hmm. So you'll be able to deliver more power, handle heavier weight. And then like, let's say you're in a position where you have to lift a car off of a baby or something, like you can do that, and then you have that added benefit, okay? So, all right. Good job. Want to give her belt?
oh.
Hold on, almost. Shay?
Thank you so much.
Okay, all right. Good work.
Do you ever put it on patient's wrist now? You just have to.
It's harder to put on
down.
All right, so next up is Kimberly, not to be confused with Kim. Don't call her Kim.
Don't call me Kim. And she is extremely brave to be in this.
Don't call me Kim.com. Okay. Okay, so just make sure that when you're putting it down, you're getting to that deadlift position. Don't round in the low back.
Like this.
Yes. Is this since you started working here, is this the first time you've ever been instructed like on a deadlift?
Started last week.
Was it? Okay, cool.
Thursday.
The third, yeah.
For like 15 minutes.
Okay.
So like.
Yep, there you go.
Is
Yep.
that too much squatting?
No, that looks fine because you're driving your hips back to lower your body. That's fine. Sometimes people think in a deadlift, they're so afraid to bend their knees. They're like, oh, if I bend my knees, it's a squat. No, it's not. It's the knees have to bend, but the pelvis needs to come back. So watch how I lower myself down, just how you are. That's how I'm coming down. I'm bending my knees versus squatting. Okay? So that's a squat, like up and down. That's a deadlift. You can definitely bend your knees. Yes. Okay. It looks good. Let's slow it down and get some breathing. Okay. Yeah, it looks really good, and I'd be interested to see you handle more weight because that'll force you to turn some other stuff on. But it looks good for just learning this. You're doing awesome. Okay, and then make sure you put it down properly. Okay, good. Cool. She passed the test. She's moving it around properly.
I've never done the left side, so this one's right.
You've never done the left side? So on camera, we're catching the first time ever that she's doing the left side.
Not yet.
Okay.
I'm doing the right.
Okay, and then I'm gonna spot you. Okay.
This is right.
Yep.
That's the one she was practicing.
Cool. And then get that wrist out of there. So there you go. Good. Kick that into the ground a couple times just to turn on your glute. Okay.
You want?
Let's actually what's called bell down. Grab a lighter one. It's all right. Have you done it with this weight before?
I tried.
I don't remember.
So like normally at first when we learn these, we actually do them with like a shoe
We usually use the 5-pound kettlebell.
or 5 pounds. Yeah, that's fine. You can do it with this.
Oh yeah. It's okay.
I like your nails. These are like perfect kettlebell nails.
They just match.
It matches clinic colors. Look at that. She got blue and white. That's team spirit. You get extra points. Okay. And then wrist. Get that wrist out of there. Good.
Do I have to kick again?
If you feel like you need to, but I would just bring this foot there. Good. Cool.
Is that right?
There's a couple little fixes there,
Okay.
but it's not too bad. Let's see how you get back down. Okay, try to get, hold on. That elbow needs to get out there a little more because if not, you're too compacted in.
Okay.
And then, there you go, good. Lower that down. Okay. Yep, that's good. How many times have you practiced this?
Maybe like 4 times.
Okay, so I mean, just to be fair, in 4 times you're doing awesome. It looks really, really good. But I think what we'll do, let's go through it, and then you practice it this week, because you're like this close. But I don't want to give it to you just because, for the sake of giving it to you. You just need to get some more reps in. But yeah.
Honestly, I think technically too, she should be testing like for her white belt.
Yeah.
Because she didn't know anything.
Totally.
But she's already
Totally.
jumping in and it's awesome.
Yeah, so great courage and awesome nails and all of that's great, but let's see. Let's see this side. Good, fix the wrist, I like it. So kick that foot in to get your glute activated. Like stomp it, there you go, good. Go and watch them there. Okay, and then we'll come right back down. You definitely got the gist of it. Bring the other hand up to para and then lower it to your belly button and then roll to your side. Okay, so the deadlift looks really, really darn good for how long you've been doing it, and the get up on both sides looks really, really good for how long you've been doing it. So don't take it as a negative thing.
It's good training.
Whatever day, like, how about we say this? How about we say you keep track of it. You get at least, what's today, Monday? So I would say each day, if you can find time to do it, do 3 to 5 get-ups on each side. Have someone spot you and watch you. Do 3 to 5 on each side, and by Friday, if you've done 15 to 25, it'll feel a lot different.
Okay.
Okay. So, but has she gotten her white belt yet?
Yep.
Okay.
She just got it.
That's what we did before.
Do you have a white belt with you?
She just got it today.
I just,
So, do we have like a permanent marker?
Oh, to write the date on it?
No, even better. Here, I'll just do it with a pen. So you get a white belt and a stripe.
Dries 'cause of-
And a stripe. So she gets a white belt and a stripe, which is like
halfway mark.
better than just a normal white belt.
All right, we have
Okay.
8 minutes left.
Perfect. Well, we got our yellow to
Oh, we
blue
can set it
testing.
now.
It's all right. So we got Emily and Helena, right?
Okay,
Who-
we got 5 minutes. That's
Who wants to go
enough time
first?
do
Yeah.
Turkish get up on each side.
From the Turkish get up, what else do you have to do to get the blue belt, other than just the get up?
kettlebell squats, clean and press.
Yeah, that's gonna take more than.
Well, let's just start doing it.
One of you, but not both of you.
I think that's what I need.
Let's just start doing it, and then what we'll do is find some time later today or after the shift, and then,
Some people will be gone after the shift.
well, no, but I mean as far as just to get with either Helena or Emily later today. Who wants to go now and who wants to go later? Okay, is that cool? And then later we can try to hook up, and I'll just keep the camera here and I'll shoot it next door or something. Okay, let's do it.
Okay, so I'll do the get up.
So in your,
Shoulder is bothering me today, so
does it hurt when you go through a get up?
it's when I like raise my arm up.
Okay, well, you don't have to raise your arm with a get up, so if it's bothering you, let me know though. I'll be here in case you need it.
Yeah, like this position actually kind of.
So pack it and tighten in that scapula and see if that helps at all. So really shoulder pack. So like hold it with your scapula and not the shoulder joint itself. Is it hurting in here?
It's like, well, not right now. Now that I've
Okay.
like pressed down.
Okay,
Okay.
all right.
I shouldn't have went to the gym before this one.
Nice. Good, very good. Smack that right leg so you don't forget which one to go back. Soft knee, good. Yeah, you got it. That looks really good. Awesome, good job. Good job. You know, it's funny, when someone does a get up, a full get up, they just look powerful. You're like, I'm not gonna mess with that person. They're doing a get up. Yeah, that's great.
Chris actually refused to do a full get up yesterday.
Because he's like, that's intimidating. You feel stable on this, right?
Yep.
Okay. Good, now look straight forward. Good, cool. And then as soon as you step back, get contact with the kettlebell again, with the eyes.
Thoracic spine. His shoulder blades don't.
Vertical with the arm, vertical, good, good. All right, I think it looks really, really good. So, definitely little tweaks and stuff that we can make, but it's like, looks good. I have a whole new respect for you now. Good job. It seriously does. It gives you, it's kind of like when you watch your wife give birth without any any sort of anesthetic or anything at home, like Linda behind the camera there. Afterwards, I was like, I have a whole new respect for you. Right? All right. So, what else do you have to do?
Kettlebell squat and clean and press.
Cool. Squat, clean and press. Are you good on those?
Will you just show me a spot really quick so
Yep.
I make sure I do it
Are you
right?
doing goblet squats? Yeah.
So squat, is here. So you come down, grab it like this. Don't hit yourself in the face. Here, right? And then you can adjust your feet if you need to. And then you're gonna breathe in. Elbows can be in the inside of the legs. And then you just say up, up, sit. Tighten your glutes at the top. So again, we're gonna go here. Up, sit. Okay.
It's supposed to be a clean motion.
Yeah, so like use that standing up deadlift to like explode it up so you can what's the word on float it up. There you go. Perfect. Try it and say up at the bottom.
Do I have to?
Just so doing it forces you to engage and get tight at the bottom. Let's hear a loud.
Oh, man.
Let's hear a loud up.
Up. Up.
Sounded very, very strong. All right, we'll work on that, but we'll still give you a pass. All right, and then you got clean and press. Okay, you want to do it with the pink? Okay, all right. All right, let's see it.
Show me a clean press really quick.
Okay, I gotta go a little heavier. So cleans are harder to do with less weight. So are you gonna do a back swing to a clean or just a hang clean? So this is.
I think it's actually easier to swing.
So that's a back, right? Versus hang clean is just here.
Yeah, I'd like to swing.
Okay, so when you swing, you're gonna step up to it. You're gonna step back like you're doing a swing, so that's the first thing. You have to step back, hip hinge, grab this, square up, here, and then press. So you lock your feet in. So you take your feet and you actually go like this on the ground. Tightens up your glutes. I mean, I'm not gonna, ding you on that, but that's to be really awesome at it. And then tight with this hand, and you're gonna go. So fist needs to be below the chin, can't be up here. So you're gonna, don't flare this up. Keep it vertical, don't be out here. Lock your elbow, and then control it down like you're pulling something down from the ceiling. Don't just go like this. Shh. Okay, so it has to be. You can use both hands if you want to dismount it. What's that? Yeah. That's something no one ever says.
I'm just saying because I knew that we were going to be doing this, like it worked out later. You can do it.
So remember, if you're gonna do a swing, step back like you're doing a swing. Yeah. Which I know you might have not done a lot of swings right now, so some of those body mechanics aren't drilled in yet. Okay. So that's good for like a mini push press because you bent your knees, but try it again without bending your knees.
Okay. Oh.
Good. Good. And then just for safety purposes, make sure you keep those fingers closed just so you don't drop it out of your hand when you're pressing it. Let's do one more. Nice. Control on the way down. Good. Awesome. Looks great. Can you do it left-sided too? And then when you bring it down, don't put it out in front of you like that because you're like extending your low back. Just drop it forward. Yeah, like straight down. Okay. Good.
I have to do a couple more now.
Yep, do it. Do 3. Control on the way down. Nice. Yeah, you look good. And then just drop it straight down. Good. That looks very good. Awesome. Awesome, good job. So today and every day, part of our uniform is our band, our belt. We'll get yours later. Belt, and then show it off to people. Say like, do you notice anything new about me? And like this, right? So like, you gotta show off your stripe, and then Emily today is gonna be like, see this yellow belt? Guess what color this is gonna turn later today? People could be like, you sound pretty confident. Be like, yeah, I've been training. Right, okay. All right, sound good? Cool, all right. That's it. We gotta get started. So Dr. Todd from Gonstead Spine Wellness and our whole team testing for our belts today. Really exciting when it comes to the health of you and your family. Results matter most.